why does the hypertension it occurs? Hypertension means increase in the systolic BP and your diastolic blood pressure. Okay. Now, why does this hypertension occur? What are the risk factors for the hypertension? The risk factors for the hypertension are the smoking, male. It is more common in male, as much as twice common in male than females. Smoking, males, and those who are having high cholesterol in their blood, that is called as the hypercholesteremia. Or those who are having high homocysteine in the blood, which is also called as the homocysteinemia. Okay, if you are having more cholesterol in your blood, or you are having more homocysteine in the blood. Okay, and other is the important factor these days are the stress. These are the risk factors which will lead to hypertension. But what actually happens in the hypertension is, when you are due to increase in the cholesterol, there will be deposition of the lipids in the arterioles. Okay, due to which there is a narrowing of the arterioles, plus there will be what? If your arteries will get deposited with lipid, slowly and gradually what will be happening? Its lumen become thin. Okay, its lumen will become thin. So there is a decrease in the lumen size. If the lumen size is decreased, it will lead to what? It will lead to decreased blood supply. It will lead to what? Ischemia. Whenever there is a BP is more than, if your systolic BP is more than 140 mm of Hg, or the diastolic BP is more than 90 mm of the Hg, this condition, it will lead to changes in the retina, which is called as the hypertensive retinopathy. And this does not occur in a day. It will take time, and it will depend upon your blood pressure. How is your blood pressure? Whether it is in control or it is going more than 180, systolic is more than 180, or diastolic is more than 90, anything, whatever it is. So hypertensive retinopathy, it will occur due to duration of your hypertension and how much is the control. That according to that the changes will occur. Now coming to very important thing, that why these changes are occurring. Now question arises, why these changes are occurring. Same way you know about the retina. Okay, retina is having how many layers? It is having about 10 layers. But for me, now important to me, it is what? There is a layer of RPE, okay, rods and cones. Okay, then outer plexiform layer, then nerve fiber layer. Now to me, what are important to me now is outer plexiform layer and nerve fiber layer. Remember these two layers. We will not discuss every layer of the retina. Just remember this, there is a layer in retina which is called as the outer plexiform layer and the nerve fiber layer. These two layers you have to remember, okay, for understanding the hypertensive retinopathy. So whenever there is an increase in the BP, it will lead to arterial narrowing of where? Of your retina. due to which you will have what? Hypertensive changes, which is called as hypertensive retinopathy. So important MCQ is, where does the hypertensive retinopathy occurs? When does it occur? It will occur only when the systolic BP is more than 140 by 140 mm of Hg, and diastolic blood pressure is more than 80 mm of Hg. Then only your hypertensive changes will occur. Now what will be happening in retina? As you know that same way the arteries are going to get blocked by your lipids, okay, due to lipid deposition. Okay, arteries are going to get blocked due to lipid deposition. So what will be happening? There is a narrowing of your arterioles, right? There will be narrowing of your arterioles. Now another pathophysiology you have to understand, that this narrowed arterioles, they will go and supply the, where? It will go and supply the layers of retina. Yes. So what will be happening? If your lumen is blocked, it has been completely occluded, there is no enough blood flow, what is that condition called? That is called as the ischemia. Due to narrowing or the occlusion of the arterioles, it will lead to what? It will lead to ischemia. Whenever there is a ischemia of the nerve fiber layer, it will lead to cotton wool spots. So what are the cotton wool spots? Cotton wool spots are nothing but the ischemia of the nerve fiber layer. Ischemia of the nerve fiber layer. Very, very important MCQ. Now what will happen? This your arteries, what they will do? They are now blocked. Yes or no? Okay. But they will be what? The arteries which is proximal to the blockage, what it will do? It will leak out the fluid. It will leak out the lipids. What it will do? It will leak out the fluid, which is nothing but the blood. It will leak out the blood. Okay. It has got occluded. Now what it will do? It will leak the blood and it will leak the lipids. When this lipids, if it is going and deposit in the, or the lipids, or you can just remember as the lipoproteins, which will go and deposit in the outer plexiform layer of the retina, it will lead to what? It will lead to hard exudates. So what are the hard exudates? They are the lipoprotein deposits in the outer plexiform layer. In the outer plexiform layer. Now these arteries which has occluded, it will also leak the blood. It will go and leak in the outer plexiform layer to give a dot or blood shaped hemorrhage. When this blood which is leaking, okay, it will go and leak in the nerve fiber layer. It will lead to nerve fiber layer. It will lead to flame shaped hemorrhage. Now if this blood is going and depositing in the outer plexiform layer, it will lead to dot and blood hemorrhage. So overall picture of hypertensive retinopathy, you can see here, like I will draw one eye. What will happen? There is a attenuation of your blood vessels. It has become very, very thin, especially the arteries. It has become very thin. So this is my optic disc and this is my arteries. These arteries will lead to what? It will lead to ischemia of the nerve fiber layer, which is called as the cotton wool spots. Same way, these arteries are going to leak blood, which is in the form, if it is this blood, if it is getting deposited in the outer plexiform layer, it will lead to dot and blot hemorrhage. If this blood is leaking in the superficial layer of your retina, it will lead to flame shape hemorrhage. It will lead to flame shape hemorrhage. And these arteries will leak small lipid out, which is called as the hard exudates. Okay, so this is the picture of hypertensive retinopathy. You can see that there is an arterial narrowing, okay, dot hemorrhage, cotton wool spots and hard exudates, and this small hard exudates. You can see that arteries, it has become not narrow fully. Okay, it was thick, now it has become narrow. So there is a narrowing of your arteriole, and you can see a cotton wool spot, which is nothing but the ischemia of your nerve fiber layer, and we are having this small yellow exudates. What are those? They are hard exudate. What are those? Lipoproteins. Where? In the lipoproteins in the outer plexiform layer. And one more thing, will have hemorrhages, which is called as dot blot hemorrhages or the flame shaped hemorrhages. Now coming to one more sign is that this is your retina, right? Arteries and veins, they will cross each other normally. Okay, they will be AV crossing present normally, but in hypertensive retinopathy there will be crossing changes. Okay, there will be crossing changes due to your arterial damage or the narrowing. There will be crossing changes. So what are those crossing changes? So here you can just see, here there is an arteries and sorry everybody, there is an arteries are crossing over the veins. Yes, there is an crossing of the arteries over the vein, right, like this. So this is the normal AV changes. But what happens in hypertensive retinopathy? These are the normal crossing, right? But what will happen in hypertensive retinopathy? At this area you will have some changes that are called as Salus sign, Gern's signs and Bonnet sign. So what is Salus sign? Salus sign, you can just see that your artery is what it is doing. It is going to what? Constrict the vein like this. Yes, this is your vein. You can just see this is your vein and this is your artery. So this artery will go and compress the vein. Okay, this is called as Salus sign. and there will be at AV crossing changes you will have a gun sign. What is gun sign? Just you can see that there is a narrowing or the tapering of the vein here at the area of AV crossing. Just you can see the how the vein it has become narrow or the taper. So this is nothing but AV nicking, which is called as the Salus sign. Gun sign is nothing but the tapering of the vein. And bonnet sign, in bonnet sign, B for bonnet, B for banking. So banking is nothing but bonnet sign. So till now you have understood. So what are the signs first? They are nothing but the arterial narrowing, AV crossing changes, arterial narrowing, AV crossing changes, then there will be hard exudates, then cotton wool spots, then dot and blot hemorrhage. Now what they have done, Keith and Wagner, they have classified or they have graded the hypertensive retinopathy. Okay, so you can know the amount of damage. In grade 1 hypertensive retinopathy, when I am examining through my ophthalmoscope, what I will see? Just there is a loss of arteriolar reflex. In grade 2 hypertensive retinopathy, what I am going to see? I am going to see the AV crossing changes. What are those? They are the Salus sign, gun sign and bonnet sign. B for bonnet, B for banking of vein. Gun sign is nothing but your tapering of the vein. Salus sign is that your artery is going to compress the vein like this. Okay, so these are the AV crossing changes, and plus you are having copper wiring of your arteriole. Means how does the copper wire it looks? It is very thin, right? So it is how the copper wire will look like that. There is a copper wiring of your arterioles. So you have learned about 3 things, and plus you will be having hard exudates. It may be there or not, or it can be dot or blot hemorrhages. Now coming to grade 3. So grade 3 hypertensive retinopathy, it is more dangerous than grade 2. Now what will be happening? Same. AV crossing changes will be there. It won't go anywhere. You are knowing. But what happened? Silver wearing of the arterioles will be there. Means you are knowing that there was copper wearing of the arteriole. Now what will happen now? Now there will be silver wearing of the arteriole. So you know that which wire is costly or which wire is thin. Silver wire is more costly and it is more thin than that of the copper wire. So there will be silver wearing of the arterioles here. Yes. Plus hard exudates, plus flame shaped hemorrhage. Now comes the cotton wool spots, that are nothing but a ischemia. Now coming to very important is the grade 4 hypertensive retinopathy. Very, very important. Here it occurs only when your systolic BP is more than 180 and diastolic BP is more than 100 mm of Hg. Then only there is an silver as well as the there is an grade 4 hypertensive retinopathy. In grade 4 hypertensive retinopathy, you are going to have what? You are going to have disc edema. Now, due to very high blood pressure, your full arteries will what it will do? It will leak. it will leak very badly. What they are going to leak? So you are having dot, blot and flame shape hemorrhages. Plus it will leak your lipids, okay, lipoproteins in the form of star in the area of the macula, that is called as the macular star. So this is the image. Disc edema, yes, there is a disc edema, cotton wool spots, and this is the flame shape hemorrhage. See, your vessels have become full tortuous, but I can't see any veins have become full tortuous, and I can't see the arteries that much properly here, okay. And here there is a radial arrangement of hard exudates, which is called as the macular star. Now, important MCQ, what is the difference between papillary edema and the hypertensive retinopathy? In papillary edema, you don't have this macular star, whereas macular star is present in hypertensive retinopathy and neuroretinitis. One more disease is the neuroretinitis. So remember this, because it is also one of the important MCQ. They will ask where do you find what is they will ask what is macular star. They are nothing but the hard exudates in the level of macula. It is in the form of star, and there is, where does it occur? In hypertensive retinopathy and neuroretinitis. Now coming to where does the neuroretinitis it occurs? Neuroretinitis it occurs in two diseases, that is the cat scratch disease and Lyme's disease So these are the very important causes of macular star. They are hypertensive retinopathy and neuroretinitis. Now coming to how you are going to manage the hypertensive retinopathy. How you are going to manage the hypertensive retinopathy? So here, who is the villain? Your villain was hypertension. So control the blood pressure. How you are going to control the blood pressure? By giving the antihypertensive drug and salt restriction, cholesterol control, smoking control. But these changes will be what? Irreversible. Once happen, one done. You will just prevent the further damage. जो हो गया वो हो गया. Okay, thanks for the listening. We'll continue with the next topic. Thank you everybody.